We serve this huge rural area. There's a lot of bad motor vehicle collisions. And we got a trauma alert that we had a family that had been in a bad car accident, and that the father had been flown to the nearest level 1 trauma, which tells you someone was very injured, and that we were receiving the mother and a 3.5-year-old girl who was not doing well. And the mother arrives, she had some injuries, but I could tell she was gonna be okay. The girl was already in cardiac arrest from the collision. And I was, obviously overwhelmed. That's never a case you wanna run. And she didn't make it. There was nothing we could do. She was too injured. And so we had to make that call, which is one of the hardest things you're ever gonna do. Then I had to go reevaluate the mother and really talk to her for the first time, and then I had to tell the mother, which is, a very difficult thing. And as it turned out, I had taken care of her, I think within a month as a patient for something that was not serious but emotional, and we had kind of had this rapport during this time previously, and I recognized her. And so it was another facet to the case that not only did I have to tell this mother that her child had died, but I actually felt like I knew her. It was probably one of the most difficult conversations I've ever had. And I think the hard part about this in emergency medicine is after you do that day, you still have an ER full of people. So the second you're done, you may have to take a few moments, but you have to get back to your shift, which is what I did. One of my colleagues, who's a physician here, she got a hold of me and she said, "We're starting this program. I think you would be a good speaker. This is the first one we're going to do. Do you have any stories?" And then I told her my story, and I didn't realize how raw it was because it's from a very long time ago. So then I realized really how important it is, because I had truly thought I had processed that story. The topic was the patient you'll never forget.
Well, when Dr. Long, she was invited to the very first Schwartz Rounds here at the hospital. When we all sat down there and she told her story, it was eyes wide open, everybody sitting there, give me the tissue, smiles as well, and she opened her heart like I hadn't seen. And I think nobody expected a physician was going to go up and open their heart like that.
When we invited her as one of our first speakers, I think that helped set the tone so that all of our providers saw her story as being an example. And so it kind of took something that would otherwise seem pretty scary, and it made it more accessible.
A lot of my colleagues and people I knew from the hospital, Jeff, but a lot of people, physicians I work with, they were in the audience, and I could see them nodding their heads. And so to have other people understand what they've been there, or they've been in similar situations.
Many of us walk around feeling like we're alone in the feelings that we have. But with Schwartz Rounds, by hearing people and sharing our common experiences around the emotional burden of being a provider, I think it really connects us to each other, and it takes something which could potentially feel uncomfortable and feel like it's almost a stigma to acknowledge your frailty and to recognize that it's common amongst us all.
Compassion, it's the key to healing. And what I like about the Schwartz Rounds, it's a structured way that it's part of our system and our beliefs, basically, that we incorporate that for our healthcare workers. So the same way I believe debriefing events shortly after these things should just be structured. It should be part of what we do rather than an afterthought. It's so important. I mean, it can't be understated. You don't have anything left to give when you've given it all away, or it's taken by emotion from past experiences.
I think sometimes, again, in the clinical world, we tend to view emotional things as of a secondary importance, but it's so fundamental to the health of the provider and the health of the team and the relationship that we have with our patients, that investment yields huge benefits. I think that was Schwartz's original concern, was that we all would just get so busy chasing the technical that we wouldn't have time for the emotional. And so he wanted to make sure that we encouraged that, that sustained attention to being kind and compassionate and empathetic with our patients.
I believe in it. I do. I've seen the negative effects of myself and other colleagues when you don't have an avenue or an outlet. And I think a lot of times, because we're professionals, people think, well, they're going to speak up if they need help. Well, no, we're the worst ones at that. We're not good at advocating for ourselves. So having a program set up where that's part of the structure is really helpful.
One of the biggest problems or contributing factors to burnout is isolation, or a feeling of not being heard, feeling that you don't have a voice. So what it does is it brings us all together, not only to show us that we're all here for the same purpose and we're all here for the same goal, but we're all here for each other, and that you're never alone.